everyone, welcome to the front row. Today we're going to talk about lower back pain. I've been a therapist for over 20 years, and by far the biggest complaint that I get is people coming to see me for lower back pain. Okay, they always ask me, Ed, what can I do? What kind of stretches can I do? What kind of flexibility exercises? What kind of strengthening can I do? Because I have chronic lower back pain. The very first thing I teach them, okay, before I get into any type of manual therapy or trigger point work or anything like that, I say you got to take the stress off of the lumbar spine. Okay, we have to learn to move in a way that takes the stress off the lumbar spine. So, quick anatomy review here. Okay, the first 7 vertebrae are cervical, the next 12 are thoracic, next 5 are lumbar, and then we have the sacrum. Okay, the lumbar spine is happiest, and we want a happy lumbar spine. A happy lumbar spine does not hurt. Lumbar spine is happiest in neutral, okay? And what I mean by neutral is we've got a little curve of the lower back. I'm not rounded posteriorly, I'm not hyperextended, I'm just in neutral, okay? So now imagine I'm bending forward, unloading the dishwasher, making the bed, whatever it is I'm doing, about 500 times a day, right? Every time I bend forward, okay, there's the fulcrum of motions occurring at the lumbar spine, okay? And what's going to happen, if you've ever had an acute back injury, you try to do that, and you're not going to be able to go. So then you're going to try to do things like this, and it just doesn't work. We have to be able to bend forward, okay? So a better way to bend forward is, okay, is to keep that spine in neutral and do a hip hinge, okay? So spine's in neutral, slight bend in my knees. I'm still bending forward, but this time I'm posteriorly translating the hips, okay? It's going to take a little while to get used to the motion, okay? And if I do it correctly, all I should feel is a little hamstring stretch, okay? Shouldn't get any back pain because my lumbar spine is nice and flat and in neutral. Remember, neutral means happy for the lumbar spine. So how are we going to train this, okay? Your PVC pipe that you guys all got from that very first video I did on equipment, okay? So it's going to help us. 2 contact points when we use the PVC pipe. Back of the skull and the sacrum, okay? So if I bend incorrectly, which puts too much stress in the lumbar spine, the moment I bend forward, I lose my sacral contact, okay? So if I bend forward correctly using a hip hinge, both contact points stay there, and when I get to the bottom, all I feel is a hamstring stretch. And the reason is because I'm getting the motion from the ball and socket joint of the hip. The lumbar spine has vertebrae that kind of stack one on top of each other. That's built more for stability, okay? So it does move obviously, but it's built more for stability, okay? The hip ball and socket joint is designed for multi-axial motion. So if you look at a joint and the way it's designed, it gives us an idea of the way the function is, okay? So you don't really want a very flexible lumbar spine. We'll get into that later, okay? But the lumbar spine's job is to give you stability, okay? So from here on out, let's try to move with less stress in the lumbar spine, keeping that spine in neutral, okay? Bending at the hips, you know you're doing it correctly because you're not going to get any back pain, and you're just going to feel a stretch in your hamstrings, which are the muscles behind your leg. If you can't get the PVC pipe on the back of your head, don't worry, just keep it straight, bend forward, see if you can get that movement pattern down, and then continually bend forward in the hip hinge. We only have a certain number of bends in our back before it wears out, okay? Give it a try, let me know how it goes, and we'll talk to you later. Bye.